if a person has sciatica, it gets trapped in between the piriformis and another muscle, and there's a sciatic nerve coming out, represented by the finger. So when you raise the person's leg, it nips, because it's trying to adapt the pelvis to being upright, but it's slightly off centre. Now, what happens with the pelvis is, we're walking that way, we're walking that way, we're walking that way, we're walking that way, is this joint here can slip. And it's a true joint, so you've got the triangle-shaped sacrum, and it can slip in between the hip bone, and it slips like that, and it's like slip-tear separation that you've got to put back in. Now when that happens, these muscles have to keep us upright so they splint. That puts pressure on the sciatic nerve, and we get what we call sciatica. So I'm going to show you, eventually as we move through the weekend, you'll clear all of this out. But one of the places you can come with the sciatic nerve is, there's one part of the hamstring, there's the other part of the hamstring, and in the middle, the sciatic nerve is right under my thumb. But also a meridian called the bladder meridian is right under my thumb. Now if I go press into a person with sciatica, he's going to go, oh, that's my sciatica, it hurts. That's Scottish for ouch. So if I put my thumb there and I bring the leg up, and I take it back down, I'm producing a movement traction. You see that? It's not so bad for you, is it?
No.
You can take, even with sciatica, if it was really painful, you can do that. But what you're doing is, if I'm doing that, I've got no place that I'm working. It's just generically working. If I put my thumb there and load it in, then I'm tractioning away now from that point, which lengthens the meridian. Now meridians are like drinking straws. When they dissect people, they don't see them, because it occupies the space between the two. So you can see the nerve, you can see the artery, you can see the vein, you don't see the energy channel. But it's there, and it needs to be lengthened. So as we lengthen them, it unblocks them. So you can free that one off. Say that was all really tight, but you can go back up and it's slack as. And you think, I haven't really done anything. That's about 65 degrees. What's happening if I go beyond there?
Okay.
It just doesn't go there though, does it? Right? And that one goes to there. Now, what we're looking for, the biggest thing we're going to do when we're doing an ANMA treatment is symmetry. Whatever one leg on that person can do, we want the other one to do. But only what's normal to them. So if the normal leg goes to there, I don't try to get to there unless I can be improved. So you put in symmetry, but that's not a symmetrical body. So when she's walking, this leg swings freely inside of that framework, and this one doesn't swing as freely because it's got a restriction. Watch the arc from that arm across my shoulders to there. See what it's doing? I'm going down, and I'm into extension because I want to go away from me. You see the movements? Because they're subtle, and you don't see them. You're probably watching my hands. Where's he got his fingers? Oh, it's dark and cheap, so you can't see this bit. So we're opening that up. A nice pain. Let's see if it was worth it.
Oh yeah.
Will that do?